Tartar, plaque and bacteria and germs build up on your teeth and are the reasons that you suffer from gum disease, tooth decay, bad breath and tooth loss. So wouldn't you like to know how to stop tartar from building up on your teeth? Well, you brush and you floss, hopefully you do, and you see your dentist twice a year, and yet you still get plaque and tartar build up. You may wonder, well, what's the point then of cleaning your teeth and having dental visits if that tartar's just going to build up anyway? And you may even feel a bit like you're failing, but I am here to show you what you can do to help you stop tartar building up on your teeth. I'm Dr. Rachel. I'm Dr. Rachel, and I'm a dentist with over 30 years experience. And in that time, I've been working with my patients to help them have better dental health and to know what they can do beyond the brush, floss, and don't eat sugar narrative, because that is inadequate advice. I want to look at why you get tartar buildup and how to prevent it. But first of all, we kind of have to understand some basics around plaque and tartar and what causes them in the first place. And it all starts with biofilm. And as a holistic dentist, I've got a really good natural remedy that stops that tartar buildup that will help prevent gum disease and tooth decay. And I'm going to share that with you later. So tartar, or calculus as it's called in dentistry, is calcified dental plaque, and it is full of bacteria, microorganisms, yeast, white blood cells, dead bacteria, dead mouth cells, and food particles. That's just such an unpleasant combination when you think about it. But that all starts from this layer called biofilm. And biofilm is a combination of bacteria, and they form together. They make a group, and they do this to defend one another from your immune defenses. Now, biofilm and the calcification of it starts the formation of tartar, and that is a survival mechanism of bacteria. It's like building a house to keep you safe and sheltered. So the bacteria, they hide underneath the calcium, which forms like a little dome, and that way they go undetected by your immune system, and even, using antibiotics, for example, would be unsuccessful. In nature, 95% of bacteria live in biofilms. Just take a look at a rock in a stream, for example, and if you pick it up, you'll notice it's a bit slimy and slippery. Well, that's a biofilm. Biofilms are pretty much everywhere. They're an effective survival mechanism, and that's been going on for a very, very long time. So anytime you have water or a watery situation, such as the saliva in your mouth, you are going to have biofilms. And if there's an overabundance of that biofilm, you're going to get bad breath, issues with inflammation, gum disease, receding gums, and if left untreated, destruction of the bone that holds your teeth in, and eventually tooth extractions. So we need to look at how to prevent that build-up of the biofilm, the dental plaque and tartar. If you're continually getting tartar build upon your teeth, it's not sufficient just to see your dentist every 6 months and then hope for the best. Because even though you're doing the right thing by having your dental visits, because that build-up is gradually happening year on year, it's damaging your gums. That period of time where you've got the build-up, so between the build-up and getting it cleaned off and this cycle of build-up and clean off, that is damaging your gums and the support structures that hold your teeth in place. It's going to cause inflammation and infection in your mouth. This then allows the bacteria to enter your bloodstream, and it affects the rest of your body, and it can cause quite serious systemic health issues like cardiovascular disease and dementia, for example. So I think we need to do more than simply accept that it's okay to have tartar buildup on your teeth and have it professionally cleaned away once in a while. So I'm going to start with some ways to actually prevent this, how to manage the biofilm, the plaque and tartar, a lot better than just brushing and flossing alone. I'm going to start talking about xylitol. Now, this is a sugar alcohol, and I'm going to link to a video that I've done for you if you'd like to know more about it. But simply, xylitol gum and xylitol sweeteners have antibiofilm properties. They help suppress the adhesions to your teeth, which means the plaque bacteria can't attach and form biofilm that then goes on to become tartar. If you're going to chew gum, make sure it's xylitol based, and you can also get xylitol mints and lozenges, and it's advised to use these after every meal and snack. Herbs. There are many herbs that have anti-biofilm mechanisms, and these are things like rosemary, clove, thyme and oregano, and you can use those as the oils. You can also use these in mouthwash or a toothpaste to help the bacteria grouping together. Then there's certain types of foods like garlic, curcumin, I think that's how you say it, which is in turmeric, and things like cinnamon. These have antibiofilm properties as well, so make sure you add these to your diet. Then there's supplements, things like NAC, which is N-acetylcysteine, which is a supplemental form of cysteine. Your body doesn't actually make it by itself. It's not found in our foods, but it still plays a very important role in our health. NAC bonds with glutamine and glycine to form tripping over my big words, to form glutathione, which is a really powerful antioxidant. And guess what? Yes, that helps to reduce biofilms. So these are a few things that you can try to add into your diet and your routine to reduce the biofilm and tartar buildup. Now, as I promised earlier, I'm going to share my remedy to stop you from getting tartar buildup. It's just got 3 simple ingredients, and I'm going to explain why you should use this to prevent the buildup and improve your gum health and reduce the risk of tooth decay. But the great thing is, because it's only got 3 ingredients, it is really cheap and it's easy to use. And if you like, you can add some of the essential oils like the ones I mentioned earlier. Now, the first ingredient is baking soda. Why baking soda? Well, baking soda is sodium bicarbonate, and one thing about biofilms, especially the ones that overgrow around your teeth in the tartar, is they start producing too many acids. When the pH, that's the acid or alkaline level, gets to the point where it's sitting around the 3.5 to 5.5 range, that's very acidic, and the body starts leaching calcium out of your bones, and this is called decalcification. This also happens in your mouth. It's really important to make sure the pH in your mouth does not get that acidic. You want it to be neutral, maybe slightly alkaline, slightly acidic, but not too acidic. Otherwise, your teeth are going to demineralize, and that is how dental decay and cavities start, because they're leaching the calcium out of your teeth to try and neutralize the acids. Also, the bacteria and the acid that they produce irritates your gums, and that can lead to gum disease. Now, the main thing that produces too much acid is sugar. It's going to produce acid from the bacteria, and it's going to make your body acidic too. If you're consuming too much sugar, you're feeding the exact food that the bacteria love, as well as the yeast in the biofilm, because the type of yeast that's in there, Candida, that loves sugar, and that's going to make the biofilm grow much faster, and they're going to get very, very nasty, aggressive bacteria. Now, as the bacteria and yeast eat all the sugar, they produce a waste byproduct. They poop, and it's called lactic acid. And now, because they're pooping out acid, the pH starts to decrease, and the environment starts to become absolutely ideal for extracting calcium from your teeth. So you're going to be getting cavities, and then of course the microbiomes start to use the calcium for their housing, and that's going to cause tartar buildup. So using baking soda, sodium bicarbonate, is a great way to increase the pH to make things more alkaline and help buffer the pH so that the acid isn't there anymore and it can't leach out calcium. So baking soda also helps to break down biofilms. your saliva makes this naturally to buffer the acid. So we're just taking something that your body is already making, therefore it's got virtually no side effects. But just one thing here, do not pour baking soda on your toothbrush and scrub your teeth with it. It is going to be too abrasive and it will wear away your enamel. Ingredient number 2 is hydrogen peroxide. Make sure you get 3% hydrogen peroxide. You can get that from the pharmacy or the supermarket. Now, hydrogen peroxide is a really good compound. It helps inhibit biofilms from developing, it kills off bacteria, and it also kills off yeast like Candida and other harmful microbes. Again, your body makes hydrogen peroxide naturally. It's in your saliva. It's a major compound that your cells use to kill microbes. So we're just giving your body a little bit more of what it naturally produces. You're just giving it higher quantities, but you have to make sure you don't use it neat. You can damage your gums. The third ingredient is water. Yep, just neat water. Not going to say any more about that. You all know what water is. So here's what you're going to do. You mix about 1/4 teaspoon of baking soda in 1/2 cup of water, and then you add some hydrogen peroxide to the mix. So you're going to use about 1/4 teaspoon of baking soda, 1/4 teaspoon of hydrogen peroxide, the 3%, and you mix that with 1/2 cup of water. Then what you do is you first brush your teeth as you normally would with your toothpaste, whether that's your regular one or a more natural one. I've done a video on that, so I'll link to that for you as well. And then what you do is, after you've brushed your teeth, you dip your toothbrush in that mix, your hydrogen peroxide, your home remedy, your hydrogen peroxide baking soda, and then you brush your teeth again with that mix. And what that will do, it will help prevent the biofilms from continuing to come back. And then that way your teeth are going to be nice and clean, nice and smooth, and you're going to have less tartar buildup. So I'll go over it again to make it nice and simple. Step 1, make your mix of water, baking soda and hydrogen peroxide. Step 2, brush your teeth with your toothpaste. Step 3, wet your brush with your anti-biofilm mix and brush your teeth again. Now, that's not where it ends, because I've got a bonus tip for you. Here's what else you can do to actually reduce the tartar buildup. There is research that shows a positive relationship between vitamin K2 inhibiting dental plaque. So some people who start taking vitamin K2, which normally comes with D3, will start to notice that the inside of their teeth are becoming smoother and smoother as they have less plaque and tartar buildup. Vitamin K2 works because it's all about transporting calcium into the bones and out of the soft tissues, and it benefits your health in that way. That also means you don't get excess calcium depositing from your saliva, which again helps prevent tartar. So I suggest you watch this video here to discover how supplementing with vitamin K2 can help prevent gum disease and also tooth decay.